Welcome to Business Voice, a program of the Greece Regional Chamber of Commerce. Each month, we'll feature business and community leaders sharing their stories, initiatives, concerns, and passions. Learn practical information regarding community resources and opportunities. Now, the host of Business Voice, Greece Regional Chamber President and CEO, Sarah Lentini.
Hi, everybody. I'm Sarah Lentini. Welcome to Business Voice. We've got a great show for you today, starting with our guests from WellNow Urgent Care, two wonderful gentlemen who represent two different parts of the business that we're going to be talking to. Business Voice is a program of the Greece Regional Chamber of Commerce, sponsored by Pet Saver Healthy Pet Superstore. We thank them very much for their support. So the two folks that are joining me here today are Chris Hart from WellNow Urgent Care, who represents the occupational medicine side of the house, something that a lot of people might not even realize exists. So we're going to be talking to him in detail about what the occupational medicine side is all about. But first, we're going to start with Aaron Silver, who represents sort of the core business of WellNow Urgent Care, the urgent care side of the house, right, Chris? Right, Aaron? And,
that's right.
And you were just telling me before we went on air that you are a physician assistant. And I think I was sort of starting to say, so what exactly is a physician assistant?
Absolutely. So first of all, thanks so much for having us. It's great to be here. And so yes, I'm a certified physician assistant. I have a master's degree in physician assistant studies, and basically what that means as far as taking care of patients is, I have a license to provide basic medical care with the supervision of a physician.
Nice.
So that can involve physical exams, taking histories, ordering and interpreting lab results, X-rays. Writing prescriptions and really providing, very high level of care for our patients in the community.
So, if you can write prescriptions, probably the thing that everybody focuses on, right? Oh, you can write prescriptions.
Well, it does come up from time to time.
Right. So that really puts you, I almost want to use the word hybrid. It puts you in sort of one of those roles that's maybe a little bit newer in the medical profession, or was this around all the time?
Yeah, the PA profession has been around, I believe, since following the Vietnam War. There was,
really?
There was some efforts to kind of train some of the folks coming out as combat medics and kind of give them more of this newer role within the community. And that's since taken quite a number of transitions, and within the past 5-10 years has really taken off and become a very, very vital part of the healthcare team, as we say. And it really allowed us to deliver an extremely high-quality level of care to the patients in our community. And
help spread the resources of probably a stretched healthcare system just a little bit further, right?
Absolutely. Part of the overburdened healthcare system, and certainly a physician shortage. And this helps to hopefully fill in some of those gaps with the best possible care for our patients.
Well, wonderful. Can you tell us a little bit about WellNow Urgent Care? Because WellNow is like this amazing business that seems to be growing in leaps and bounds, right? And of course, you're members of the Greece Regional Chamber. Thank you very much. You're premium members, in fact. We really we love the connection, and we know that you've had 3 ribbon cuttings, 3 grand openings in Monroe County alone in the last, I'm going to say, 1 to 2 years, right? In the last 18 months or so.
That's right. And we're certainly so proud to be a part of Greece and be a part of that community and be able to extend our services to that wonderful patient population. WellNow Urgent Care originally was founded as 5-Star Urgent Care in 2012, with a location, I believe, in Big Flats, New York.
Of course, Big Flats.
Absolutely. Somewhere in the southern tier.
Thank you. I was going to ask that next.
And since then, it's really taken off and become one of the faster-growing urgent cares in New York State, and has actually now extended out of the state and opened a site in Crestwood, Illinois this past year.
Oh, wow.
So really kind of extending the reaches of that business.
So started in New York State.
Correct.
Southern tier.
Yes.
Now how many WellNow Urgent Cares do you have across the state of New York?
35 that are open today in New York.
Wow, 35.
Yeah.
Awesome.
With a handful still to open by the end of the year.
Even in New York, you've got a handful to open by the end of the year.
Yes.
So there's a plan, obviously. Somebody's got a plan, because this doesn't happen. Is there? And you're opening in Illinois, you said, or you already opened a place in Illinois.
That's right. Yeah, there's a location in Crestwood, Illinois, outside of Chicago.
Wow. And is that you said that's the first one outside of New York State?
I believe so, yeah.
Correct.
Okay. And so that's a big leap from New York to Illinois, right? Is it just because Chicago is such a great market? It's a big market. Do you happen to know why? And are you planning on filling in the states in between, or do you have even another state after that on the docket?
I think there's always things people are looking at. Nothing planned or upcoming, but our sister company is Aspen Dental, and they actually opened a second headquarters in Chicago. So we kind of piggybacked on that opportunity and are opening actually a second location in a few weeks out in that market. So
wow,
yeah, it's exciting.
So are you guys privately owned?
We are, yes.
You are, okay. And was this is there a particular person, or is it a group of people that's behind the company and the growth, obviously?
In 2012, this was opened by Dr. John Radford. He was a talented emergency physician who came up with the idea and really kind of taken the company through these transitions and tremendous growth.
Wonderful. So it's coming from somebody who really knows. If he's a physician, presumably he knows the healthcare system well.
I would hope so.
He knows care well. He knows the healthcare system well, and that's probably part of the reason for your great success, that you're not being run by somebody who's simply a business person.
Absolutely. Yeah, I think there's a tremendous collaboration between business and the medical side of things, and that joint effort's really been able to allow us to offer such a terrific product and service for our community.
Right. And urgent cares, of course, are mushrooming in general, right? Because, I mean, there are a lot of urgent care centers that have, of all sorts that have sprung up around me, like just where I live. So this is probably a very good time to be in this particular market, but it's also competitive, I imagine. It is.
There are a large number of urgent care facilities and options for patients in really, most communities across the state. Mm-hmm. What we believe really differentiates our group is something that, is a combination of high-quality medical care in conjunction with, offering certain conveniences that may not be available elsewhere. One of those is the ability to actually save your spot in line, where a patient can go onto our website. They can get an estimate of the wait time for the particular site that they want to go to, and then they're actually put their information in and hold their spot in line. So hoping that really kind of puts power in the hands of our patients to, make the experience of getting care from us as convenient for them as possible.
That's great. And urgent care is sort of that, that intermediary, that solution to having to wait forever in an emergency room, right? But, I mean, people are going to urgent care also in lieu of going to see perhaps a primary care physician, especially if they don't have one yet, correct? Tell me a little bit about what the urgent care services are, and then I want to hear a little bit about Chris's services, because occupational medicine is like a whole other thing, right?
Absolutely.
Yeah.
So, urgent care, our main focus is non-life-threatening illnesses and injuries.
Okay.
So that can, as far as illnesses, that can be coughs, colds, sore throats, rashes, and, again, non-serious injuries, sprains, minor fractures, lacerations, small burns. It's certainly not a means to replace primary care medicine by any means, more to be able to supplement it. Where patients, if they're unable to see their physician or a medical provider, during business hours, and this hopefully gives them a good option outside of those hours, weekends, to really be able to get the care they need in a timely and efficient manner.
And you just made an important point, which is that urgent care isn't meant to replace the emergency room either.
Certainly
so if you
not.
have a very serious emergency like a gunshot wound, you should not be going to urgent care. You should be going to the hospital.
Please do.
Please do. Great. Thank you. Before I gave bad information out over the airwaves, right?
Yeah, appreciate that.
Absolutely. And having said that, it is really very convenient to have urgent care centers nearby. I think we've all been in the situation where we're grateful to have one to turn to. I know I am, and it's it's great to know that you guys are being led and spearheaded by somebody who understands care as well as he does, and as you all do. But you don't just offer urgent care services; you also offer occupational medicine services. And Chris Hart is here today to talk a little bit about the the occupational medicine. I don't quite even know what that means,
Sure.
of course. So please tell us, Chris.
Yeah, so just like we partner on the urgent care side with the community, we also partner with employers and businesses and organizations in the communities as well. So we provide a wide range of services for employers, from basic drug screens and physicals to complicated physicals. We treat work-related injuries, anything there in between that an employer might require for their employees.
That's great. So you're really a service to business.
Correct. Exactly. That's the side of the house that I represent. Sure.
And how does a business go about sort of working with you? Do you work under contracts with businesses? Can they just reach out and ask you for assistance sort of as a one-off?
Yeah, absolutely. So there's no contracts. We basically set up an account, and it's two one-page forms, so it couldn't be easier. And then from that point, people can use us as little or as much as they need to, from the one-off situations to folks that, being that we're New York State's largest occupational medicine provider with all of the locations we have, we can provide like that one-off situation or work with somebody who also has a statewide footprint, and that need to have access to not only occupational medicine services, pre-employment services, but those work-related injuries that might come up and have an option to go to.
So does work-related injury means workers' comp?
Correct, exactly.
So if I'm an employer and I have somebody who gets injured on the job, how might I work with WellNow Urgent Care? Would I pick up the phone and call you?
They can come right in. We're a walk-in facility. We're open 365 days a year. Besides holidays, we're open 8 a.m. to 8 p.m. 7 days a week, plus holidays, sometimes adjusted hours. But those folks can come see us. Hopefully they have already reached out to us and we have an account. But either way, we're going to see those injuries and get those folks can walk right in any area that they're in the state that we're close to.
Do you work at all with the workers' comp claims or not so much? That's really handled by the company?
Yeah, so we'll facilitate the visit and then, get the information back to the employer as to, the treatment or the result, and then they'll handle the claims piece from their side.
From there. Yeah. And then did I hear you mention like drug testing? So for some employers, that might be an important component, a requirement of employment.
Yeah, absolutely.
It might be something that they need to do on a regular basis. I'm just going to guess that something like a school bus driver maybe needs to sort of be, I don't know. I'm really guessing. I have no idea what the requirements are, but I could see how, especially in certain occupations,
absolutely, that
certain types of testing would be, ideal.
Yeah, there's multiple options or reasons why folks do drug testing, whether it's a pre-employment screening, whether it's a post-accident. Sometimes folks, when there's a post-accident, they want to, rule those things out. And then there's, the DOT industry where it's randomly required, as well as an ongoing basis. But, folks have a random program that they're a part of. We handle all of those options for drug screening. And
I know you mentioned a couple of these and we've touched on them, but just to say them all again, because I don't think my brain absorbed them, so maybe people listening wouldn't mind another refresher. So obviously the drug testing, helping people with a physical or an assessment for a workers' comp or a workers' related injury. What other sorts of services fall under this umbrella? So
physicals, there's probably multiple options or reasons for the physicals, whether it's a DOT physical, like I said,
Department of Transportation,
correct, in environmental industry, so abatement industry, we have asbestos physicals, hazmat physicals, silica exams, all these things required for folks to be working in those industries. We do respirator physicals for firefighters, for anybody that requires wearing a respirator for their profession.
And you're working. This is a service you can provide to businesses so that they can make sure that their employees have the sort of protections that perhaps are required in addition to the public if they're interacting with an employee.
Absolutely. So
also has some protection.
Anything that OSHA would require.
That's what I was thinking.
So we keep those folks safe, and then there's industries outside of that. So even like assisted living facilities, their folks would sometimes require maybe some pre-employment physicals, a general physical, some drug testing, but more PPD.
What's PPD?
Tuberculosis.
Thank you.
And so checking for that. X-rays, we have X-rays on site at all our facilities. Audiograms for hearing. If you have a hearing program, we have vision machines, blood work.
Lots of stuff.
Vaccines, titers,
so
you name it, we do it. We're
the
a one-stop
traditional
shop.
Drug test, much more involved than one might think.
Absolutely.
So,
it allows us to service, a wide variety of industries that require different services for their folks.
So was this part of the business when you guys started, or is it a newer part of the business? And what made you offer these services?
Yeah, it's always been a part of the offerings from day one. I don't think it's, today we represent 20% of the business, and I think we've really brought on a team to focus on that over the last year and a half, 2 years. So that part of it has grown. We just, saw the need as we're in the community serving folks, and even employees would come in for personal reasons, whether it was themselves, their family, and then realize we offer these services. And we've kind of, as the footprint's grown, the business has grown, so these opportunities and the ability to service folks, locally and across the state.
So this is a growing segment of your business and a growing segment of the healthcare business as well. Is that correct?
Yes. It's existed for a long time. These services have been needed. OSHA has been around for a long time and require all these things. But for us, it's a big part now of what we do and trying to grow that field and get our name out there to let folks know it's an option for
Wonderful.
what we offer.
And how long have you been working for WellNow, Chris?
I've been with WellNow for a year and a half.
And were you in the occupational medicine field before that?
No, I was in the sales. Actually, healthcare in a sense. I worked for the American Red Cross before this.
Wonderful. Yeah. Well, a related business, however.
In a sense, in a roundabout way, absolutely.
Yeah.
Yep.
Certainly still involved with healthcare and community well-being.
Right.
So, did you work for the Red Cross here in the Rochester region?
I did. Yes.
Wonderful. Yeah, they're a great organization as well. So, and how long have you been with WellNow, Aaron?
Coming up on 2 years in November.
Wonderful.
So a little bit, about that.
And were you working as a physician assistant before that? Is it physician's assistant or physician assistant?
No
Can it be
apostrophe.
either way? No apostrophe.
Right.
Okay.
So physician assistant. Physician
Okay.
assistant. Yes.
Got
So I've been working right now for about 6 years. I started my career in Philadelphia, and then prior to my start with WellNow, I was in the emergency department at Rochester General Hospital.
Oh my! So you got a little trial by fire, right?
That's right.
Yeah,
That's
you know a
right.
little something about emergency medicine. So that's
absolutely.
That's great.
And a lot of our providers are kind of trained under the same circumstances. Local emergency departments, many from family medicine clinics. So really come with a number of years and varying experiences that we can kind of bring to the care we provide.
That's great. And are you from Philadelphia originally?
I'm not. No, I was born and raised in Brighton.
Oh,
and
okay.
I live in Arundel now.
You just happened to be in Philadelphia when your career began.
That's right. I went to grad school down there at Philadelphia University.
Very nice. So as you guys kind of look out to the next few months and few years, first of all, it'd be great to tell people where you are now, right? Because I know you've got 3 locations in Monroe County alone, and I don't know their addresses or anything, but just to at least make sure people know that you've got a strong presence in Greece, and you have a strong presence in Irondequoit, and a strong presence in Fairport, a.k.a. Parenton. It's really more Parenton, but everybody calls the entire town of Parenton around here Fairport for some reason.
Right.
And which I've never understood. But so and you've done ribbon cuttings. We've been honored to participate with you on the grand openings of all 3 of those. I know you have more coming in Monroe County. But obviously you've got, perhaps even more coming online elsewhere in New York State. And I imagine that there are a variety of ways that people can access your services as well as news about you. For starters, a web address might be a good thing. how do people connect with you? How are they going to find you? And we want to make sure they leave, understanding remembering your name and understanding how to get in touch with you.
Yeah, I think, visiting our website, wellnow.com, has a list
nice
of...
and simple. Wellnow.com.
Very
wellnow.com.
easy. It has a list of all our locations. We update. We have all our wait times are listed for every single site. They're updated every 15 minutes. So if you're in between two locations, you can kind of see what's the fastest service time for you and get there. But and then it also has a list of our upcoming locations where we're looking to grow next.
Great.
So there's a lot of opportunity. Our next location here in Rochester is opening in about just a little over a month in Gates. It'll be over on Lyle Ave, right off the 390 exit across from Wegmans.
Real close to us, and that's wonderful news.
Yes, we're excited about that location.
Very, very exciting.
Absolutely.
I thought that was coming soon, but I wasn't sure, so awesome. Yep. In case you're just joining us, you're listening to Business Voice, a program of the Greece Regional Chamber of Commerce, sponsored by Pet Saver Healthy Pet Superstore. I'm Sarah Lentini, and I'm here with Aaron Silver and Chris Hart, both of WellNow Urgent Care, which is a wonderful business that is obviously focused on helping people stay healthy, and giving them an additional option for service that goes above and beyond the emergency room, doesn't replace the emergency room, but might help to supplement some aspects of the emergency room and also primary care physician services. So before I let you go, I want to hear from both of you a little bit of this, and that is, what made you get involved in the field you're in? They're high-pressure fields, yours in particular, Aaron, because emergency services, obviously, maybe a little bit less so on the WellNow urgent care front, but emergency services in general can be pretty stressful. And I imagine, I don't know if you work long hours, but tell me a little bit about what your work is like and why you chose to get involved. And do you regret it? Or are you happy?
No, still very happy with my choices, and really everything I've done, for my adult career has been focused on taking care of patients. So this for me was a natural next step, moving from emergency medical care into urgent care, where I really have an opportunity to connect with patients from all ages. I can really develop a good relationship with the folks in our community that we serve. So it's been a great privilege and a joy to be a part of WellNow and to be a part of the Greece and Irondequoit and Fairport communities. So
you work in all three?
I do, mostly in Greece, but I get out to the other sites here and there. And so it's been wonderful to be a part of that, and we're so excited for Gates and for everything we have in the future coming up. That's
great. And how about you, Chris? I know that you've been involved in occupational medicine specifically for a shorter period of time, but what drew you to it?
Just the company itself. It's an incredible company to be a part of. Very family feel to it. The opportunities it provides and the direction it's headed. It's all really positive and really important to me on this. As representing this side of the house. To be a great partner for businesses, especially in the community I live in. So I think this WellNow offers that opportunity, and really excited to be a part of it in the company and where we're headed.
Awesome.
Yeah.
Thank you guys both so much for joining us here today on Business Voice. Chris Hart, occupational medicine. Aaron Silver, lead provider for the region, I think, right? We so appreciate your being here. Thank you for joining us here today on Business Voice.
Thanks so much for having us.
Yeah, absolutely.
All right, stick around. We'll be right back with our next guest from Medical Resource Solutions. Don't go away.
Pet Saver Healthy Pet Superstore.
Get all the advantages when you shop at Pet Saver.
Like our do-it-yourself pet wash for just $9.99 every day. We supply all the shampoo, towels, tubs, and water. And we clean up after you, too.
The Pet Saver-friendly staff helps you protect your pet from fleas and ticks with simple, safe, economical, and vet-recommended protection.
We are here 7 days a week in person to help you find only the best pet food, treats, toys, and more.
Can't get that online.
Remember, every time you shop at Pet Saver, you are helping to feed our local shelter pets.
Do your community and your pet a big favor.
Shop at Pet Saver!
The Love Your Pet More store.
Pet Saver Healthy
In Greece, Monroe Ave in Brighton, Webster, and in Victor next to Party City across from Eastview Mall.
At Canandaigua National Bank and Trust, we understand that each business has its own unique financial needs. We also recognize that it takes a collection of banking services to meet them. That is why we assemble a team of financial experts to provide deposit, lending, and cash management solutions to meet them. Let us put our market knowledge and local decision-making to work for you. Canandaigua National Bank and Trust, investing in you, your business, and your community. Deposit Products Member FDIC.
If you're looking to market and grow your business, make new business connections, and give back to the community in a meaningful way, consider joining the Greece Regional Chamber of Commerce. We're the largest suburban chamber in Monroe County, and we offer networking, education, marketing, insurance, and advocacy. You do not need to live or work in Greece to join. Our members come from throughout the region. In short, we're better together, and together, we're moving business forward. Visit greecechamber.org or call 585-227-7272 to join today.
Of course, you love your pet. That's why it's hard to believe that you're feeding them the wrong food. Yeah, 70% of dogs and cats are eating the wrong pet food. It could be because they're getting older, a little overweight, or have allergies. Pet Saver Healthy Pet Superstore can help. Bring in your food or take a picture of the label, and a trained staff member will let you know what is really in the food. They know how to accurately read the labels and give you the truth about what you're feeding or not feeding your pet. If you need a change, they can recommend a food that really is healthier for your pet. And because Pet Saver carries more premium food than any other store in town, including the national chains, you might even be able to pay less for a food that is better for your pet. Are you one of the 70% of pet owners that are feeding your dog or cat the wrong food? Find out for free at the Pet Saver nearest you.
In Greece, Monroe Ave in Brighton, Webster, and in Victor next to Party City across from Eastview Mall.
You're listening to the voice of liberty.
WYSL.
AM 1040 Avon Rochester, FM 92.1 Rochester, and FM 95.5 Spencerport.
Welcome back. You're listening to Business Voice, a program of the Greece Regional Chamber of Commerce, sponsored by Pet Saver Healthy Pet Superstore. I'm Sarah Lentini. I'm delighted to welcome my next guest from Medicare Resource Solutions, Deborah Adams. Welcome, Deb.
Well, thank you very much. It's good to meet you, Sarah.
Lovely. So Medicare Resource Solutions obviously deals with Medicare. The name is nice and clear, right? Gives you a little sense immediately of what your company does. But do tell us, because Medicare is it's a big universe. And this is a very timely kind of a conversation, because open enrollment is, believe it or not, just around the corner, right?
That's correct.
So tell us a little bit about what your company does.
Okay. When it comes to Medicare, you have choices. And as an independent health resource company that we are, we can offer you Medicare plans with all of very many different companies. We're licensed with all of the local companies in our area and many across the country, many national companies. And so it's our job to help find the best fit for you. Like a shoe salesman used to do years ago. They would measure your foot, they would put you in a shoe, and then you'd walk around and feel it, make sure it fits good. That's what we do at Medicare Resource Solutions.
I love that analogy. It's a great one.
Thank you.
And so you really pride yourself on, customer service, working with somebody, really understanding what they need, maybe taking more than a 2-second, soundbite or period of time to help guide somebody. Is that right? Yeah.
Absolutely. All of our agents at Medicare Resource Solutions not only supply you with business cards, either at the beginning of the meeting or at the end, so that you have multiple, but also a magnet to put on your refrigerator. We don't want to be lost. We don't want to sneak out the door and be afraid that you're going to call us, because that's what we pride ourselves in, is not just fitting you, but also servicing you from that point on. We want you to stay with us year after year. The market changes. Every fall is open enrollment, annual enrollment period by name now. Every September, every Medicare Advantage and Part D policyholder receives an annual notice of change from their insurance company, and that's the time that you a Medicare person, a Medicare beneficiary, needs to take a look at what's in that material, especially the first couple of pages. It will show you what is changing in that plan that you are currently in for the following year. The price might be changing, the formulary might be changing, the benefits might be changing, and so that gives you that opportunity to then begin looking as of October 1st to find out what are the other plans that are being offered either in that same company or with another insurance company. And so that's where we come in.
Wonderful. And so October 1 is the start of open enrollment, correct?
Well, technically, they call it annual enrollment period is October 15th through December 7th. Okay. That's the time when you can sign an application and enroll. But being able to share information for agents, for folks, our time that we can begin talking about what is available for 2020 is October 1st.
Got it. So October 1 for the new plan information, the new year information. October 15th is the actual beginning of the period when you can sign up for a new plan.
That's
correct?
right. That's right.
And you're signing up between that, was it October 15th to January 7th?
October 15th. To December 7th.
December 7th.
And actually, if you enroll into one plan or commit to something, let's say on the 15th or the 20th, and then you discover, oh, there's something better, you can apply for that. A person can apply for as many plans as they want to and companies from that time period. But as of December 7th, that's when Medicare drops the hammer, so to speak,
right.
And the last plan that you enrolled into is the one that will go forward and become effective January 1.
January 1. So a January 1 effective date. Wonderful. And you mentioned that you work with many insurance companies, right?
Yes.
All across the country.
That's true.
So obviously we've got some great ones right here in our community, right here in New York State, names that people are very familiar with.
Yes.
But then you have an even bigger portfolio of possibilities to share with them, correct?
That is very true. And depending upon the company, depending upon the services that are provided and what is in the plan, oftentimes we'll determine which plan an individual wants to go into or what fits them best. We need to look at prescription drugs. We need to look at networks when we're in Medicare Advantage. We need to know that that plan is going to fit you. And you're not stable. Your health is going to change down the road. You might become a snowbird. You need protection or insurance benefits in Florida or Arizona. So all of these things are always changing, and that's what we are there for. One unique thing that we have in New York that practically all other states do not have, and that is EPIC. EPIC.
For drugs, prescription drug
Well,
coverage,
EPIC
right?
is the Elderly Pharmaceutical Assistance Program offered in the state of New York, offered to seniors that are age 65 or older, must have Medicare Part D drug and be eligible for A and B to be able to enroll into the EPIC. And if you have EPIC, which it's now available to a lot of folks. If you're single and your income for the previous year was $75,000 or less, or you're married and your joint income was $100,000 or less, you're eligible. So what EPIC does is it gives you an opportunity to have a extra enrollment period once per year. It's called a special enrollment period. So it's really nice.
And that special enrollment period is for all aspects of Medicare or just for prescription drug coverage?
No, it's
and
for
Part
all
D?
aspects.
All aspects.
The EPIC plan is designed to protect you if you have a lot of expensive prescriptions. It's based upon your income. It's on a sliding scale, and it could actually help to subsidize you on the cost of your prescriptions, lower the cost, even pay your Part D premium if your income is under $23,000 single or $29,000 married. So it definitely plays a positive role for residents of the state of New York, thanks to Governor Cuomo, who voted it in to change the the eligibility. I'm not being political, please. I'm just being honest.
It's a very positive thing for folks that are looking for assistance with pharmaceutical prescription drugs and that are age 65 or older and obviously have to meet some income qualifications as well.
Right.
So, and it's New York State only that has anything like this? No other state?
There are about, as far as I know, about 7 states that have this type of thing. It's called, under Medicare rules, a state pharmaceutical assistance program, SPAP. So on the application, that's what we have to check as agents. That gives you the right to make a change, let's say in June. Let's say, you enrolled into a plan, it started January 1, and suddenly things are changing and your doctor's running tests and things are not looking good, and that low-cost Medicare Advantage premium, maybe a zero premium plan that is more copay than the higher plans, is going to be costing you a lot.
Right.
Then that you are an ideal candidate to find out, let's see if we can make a plan change and improve your situation for June so that you're not going to be experiencing the maximum out of pocket that the plans carry in Medicare Advantage. And at this present time, that's about $6,700. That's a lot of money to spend.
Sure is.
Whereas you could be moved into something else if you're eligible for EPIC, if you have EPIC, and you have a good agent.
Wonderful. And you have a good agent. So in case you're just joining us, you're listening to Business Voice, a program of the Greece Regional Chamber of Commerce, sponsored by Pet Saver Healthy Pet Superstore. And I'm delighted to be sitting here with Deborah Adams from Medical Resource Solutions. Deborah is a member of the Greece Regional Chamber of Commerce, and Medicare Resource Solutions is, a company that really provides all kinds of assistance to people for Medicare plans and services, and and the list of opportunities is pretty large and wide and national in scope. You're based right here in Rochester, is that correct?
Yes, we are based in Rochester, but we are in upstate New York, Western Pennsylvania, and we have a website. I think it's cute. It's MedicareResourceSolutions.com, but we also have a team out in Arizona that is reconfiguring the entire thing. So as of early September, there will be a whole new face of MedicareResourceSolutions.com on the website, and we hope to be going national. So
wonderful.
We're targeting to be national and at the top of Google search in 6 months after launch.
Good. That's great. That's wonderful. We're looking forward to that.
Thank
you. The company is relatively new, correct?
Medicare Resource Solutions, Inc. was born in June of last year. Mm-hmm. Okay. We are now beginning our second year. We have a large number of agents in Western Pennsylvania and upstate New York, and there is a program that's happening this fall that you may be interested in. The program is called Healthcare Begins Here at the Walmart superstores across the country, and we are fortunate enough to have 10 stores in upstate New York and Western Pennsylvania that will be participating in this. Locally, the Victor store. Mm-hmm. And you'll see one of our agents there.
Oh, cool.
Practically the entire time it's open, along with, we have 10 stores throughout Western Pennsylvania and upstate New York.
All with Walmart.
With Walmart. Walmart superstores.
That's a great partnership.
Absolutely.
Wow. Awesome.
One other thing I should add with Medicare so that your listeners have a general understanding of things is that beginning 2019, this past year, Medicare rolled out a new feature of Medicare enrollment periods called OEP, Open Enrollment Period for Medicare Advantage members. As of January 1, anyone that is enrolled in a Medicare Advantage plan would like to make a change of that plan, they have the means of making that change by just saying, I want to change. And between January 1 and March 31st, the change that they make will take effect the first day of the following month that they elect the change. That happens sometimes whenever someone realizes, the doctor that I'm seeing is not in network. I didn't know that. They may have enrolled online. They may have enrolled themselves, or an agent may have failed to do the due diligence that we do at Medicare Resource Solutions. Either way, sometimes things change, your health changes, and you want to change plans under that rule. So open enrollment period is something that happens beginning January 1.
And that's an awesome new provision, right?
Absolutely.
Because I imagine often people do end up starting the new year. All these plans would be effective January 1. Then there's a little hiccup, something they didn't understand, something they didn't realize, and this really gives you the opportunity to make a one-time course correction, basically, for the year, correct?
Absolutely. Sarah,
Yeah.
It was born out of that, actually. After all of these years, lately, with more and more new agents coming in and more opportunity to enroll yourself online or making a phone call for a toll-free number, that these things are happening more and more. Up until this year, January 1 of 2019, a person only had until February 14th to disenroll, and they could only be disenrolled by Medicare. So if a person called their insurance carrier on the 15th of February, they were told, we're sorry, we can't help you, we're sorry if this happened, but you'll have to call Medicare. So obviously these calls and complaints and problems have been growing over the last few years, and so Medicare resolved it this way.
Great solution.
Absolutely.
A really great solution.
Brilliant.
Kudos to Medicare.
Yep.
That's great news. So your company's not that old, but you obviously have been working in this field for a while, and you're a licensed agent, licensed broker.
Absolutely.
Yes.
I have been in this insurance business. I've been in insurance since 1982. If you go to our website, there's one tab at the top that has my name. So, Deborah Adams, if you wanted to learn more about me, my background, I'm there. But you'll also, right now, we don't have all of our agents showing on the website, but when this new website rolls out the 1st of September, you're going to see everybody. Even we have 9 agencies, a cluster of agencies that's all one over in Western Pennsylvania. It covers 9 counties.
Oh, my goodness.
It's huge.
It is.
So our growth has just been tremendous. But that has a lot to do with the people and the people that we work with upline.
So Deborah, are you the person who started Medicare Resource Solutions?
I started it with my son. He decided to come into the business in 2016, and after training him and the joy of training him and seeing him produce and do things the way they should be done, and running into so many people that were telling us, well, so-and-so said this or that, and I said, that's not right. We'll always correct you, and so will our agents. If you don't understand something, we will correct you because we want the right information communicated. Anyhow, it just grew out of that. I decided, I can't really grow my book of business any larger because it's the way it is, other than my friends, the referrals of my members and their family. But other agents could, and I'd like to really see if I can help other agents. And so we've grown. We've grown really fast, and I'm anxious to keep growing.
Absolutely.
For now.
And we're particularly honored because the Greece Regional Chamber, I think I might have mentioned that you guys are members of the Greece Regional Chamber, but which is wonderful.
Yes.
But we're going to be celebrating. Right?
You
We're going
are
to do a little grand opening, a little ribbon cutting.
We are so honored to be a part of the Greece Regional Chamber. We joined the Greece Regional Chamber at the spring at a program at the Health and Home Expo, and got to meet Sarah and Sue and a couple of the guys in that, and so we are so honored to be able to do a ribbon cutting ceremony at their facility.
Yeah.
And so if you're hearing this message, please come out.
Come join us.
What's the day of that?
Yeah. The two of us probably need to figure that out. It's in September, and it's right on our website. So if you go to greecechamber.org, right on the home page, we've got a little calendar in the top right. You can click right on the event, which is the grand opening and ribbon cutting for Medicare Resource Solutions, and you can register right online. There is no cost. We appreciate a registration. You don't have to register, but it helps us know how many people to expect. And we're going to do the ribbon cutting celebration right at the Greece Chamber office, which is 2402 Westridge Road, right in Greece, Rochester, New York, technically. But please do come and join us. It's a fun an important way to mark the occasion of a great new business joining our community, and we're delighted to be doing this with you, with Deborah Adams. And I didn't know you had started this with your son. What a joy indeed! So your son is also in this business.
Oh, absolutely. 24
Nice.
And he's just wonderful, yes.
That's
he's
great.
my partner.
That's great. Yeah, we're looking forward to it. Next time you have to bring your son, right?
Okay.
So we've got a great new business, and you're setting the bar high, and you're bringing a ton of experience and lots of different qualified people together. I'm really understanding this across the country, also across the region right here, which is the part that we care about. And as you kind of move forward here, I'm wondering if you have any other events that people might want to be aware of. Certainly, I hope that you're going to participate once again, by the way, in the Health and Home Expo. That is indeed where we met every February at the Northwest Family Y on Long Pond Road. The Chamber has been holding a Health and Home Expo, free and open to the public. Lots of great exhibitors, some having to do with healthcare, obviously Medicare, but lots having to do with even other topics that would be of interest to families, to the general public. So are you're going to do open enrollment meetings at all for people?
We're going to start the year off October 1st, which is the time that you start shopping. Mm-hmm. Looking. We will start, I've got October 1st, 2nd, and 3rd, and then there's a total of 21 days at the Irondequoit Library.
Nice. On
the first floor. And on the 4th, we'll be at the Albion Hogue Library in the Curtis Room. That's at 134 South Main Street in Albion, New York, our next county over. And then in the afternoon, that's going to be at 10 o'clock. And then at 1 o'clock at Sweden Clarkson Rec Center. That's 4927 Lake Road in Brockport. So both of those are going to be Medicare 101 AEP meetings. And then on the next day at the Lighthouse Bible Baptist Church, 48 South Estate Drive in Webster, and that's going to be a huge event. We're sending out special invitations to the residents of the Webster area, along with the Albion and the Brockport and Spencerport areas. We also have some things happening in Macedon and in Williamson, but we don't have the date and time yet to give you, but you'll be hearing about them.
That's wonderful. So is everything on your website if people go? Yeah.
It will be on the new website. On the current site, we're not putting this out yet.
Okay, so hopefully in advance of most of those, if people go to, they should go to your website anyway, right?
Yes, go to our website today and check us out, and go to the Chamber Regional website
as well,
so that you can reserve to come to our ribbon cutting ceremony. It'll be so much fun. It's going to be on the 17th at 4:30 off of West Ridge Road at the Greece Regional Chamber. There'll be some
light refreshments. We're going to have some dignitaries. We'll have a little ceremony. We'll have the red ribbon, real big sharp scissors, some photo ops, lots of opportunity to network, which is always a great thing for everybody involved. And again, that's Tuesday, September 17th, 4:30 p.m. at the Greece Regional Chamber. Go to greecechamber.org. That's greecechamber.org to register for the ribbon cutting. Free and open to the public. Free parking right outside our door. Can't make it easier than that. And Deborah, how do they get to your website? Medicare Resource Solutions is
.com. Medicare Resource Solutions.com.
That's it. MedicareResourceSolutions.com. And oh my, what a great range of opportunities. I'm assuming those are all free and open to the public. All the opportunities that you mentioned at all the different venues across Monroe County. In case you're just joining us, you're listening to Business Voice, a program of the Greece Regional Chamber of Commerce, sponsored by Pet Saver Healthy Pet Superstore. I'm Sarah Lentini, president of the Greece Regional Chamber. I'm here with Deb Adams from Medicare Resource Solutions. And before I let you go, I want to talk about something that we were talking about just before we started, before we came in studio, which I think is so important, and that is the ability for businesses to offer group Medicare to their employees, right, that are 65 and older. We were talking about how there's so many more people in the workplace than there used to be who are over 65, right? When I was a kid, you turned 65, you're retired. today that is no longer the case. So tell us a little bit about group Medicare and how that works.
Yes, with group Medicare, it's offering usually a Medicare supplement plan as opposed to having an employee that is age 65 or older staying on the group insurance. The employee can actually benefit themselves by moving off of that medical insurance onto a Medicare supplement plan. And in our upline hierarchy with Medicare Resource Solutions, we work through a group that they're over us, and they're the ones that created this whole concept and rolled it out, and major insurance companies have now picked up on this concept. And that group, by the way, has one of the largest unions, actually the largest automotive union in the country. So we're very proud to be a part of their organization. Wanting looking for a position, give us a call, or anybody looking for a good agent, give us a call, or a business wanting to look into the group Medicare insurance, please give us a call. We would be very happy to do a lot of work for you and let you know how this all works out. All the materials are created in your name. All of those things have already been laid out by these great people that we work with. So,
and if I'm a business owner, do I have an obligation to offer group Medicare to my employees if they're Medicare age?
Good question. No, you do not have an obligation. And in fact, there are rules that you would know as an employer with seniors that are employed that in some cases you can't move them. You can't ask them to leave your group insurance. This is where we come in because we are agents and we're able to, if there's a benefit for that employee, we are able to show them that benefit. And in some cases, some employers will support some of the payment that the employee pays for their own independent supplemental insurance or some of their Medicare costs. It could go anywhere from 0 up to 50% or 75%, whatever the case may be. But those things are all worked out individually. It's involved.
But just to kind of go back to this, which is if I'm employed and I'm 65 or older, I may be able to stay on the businesses, on the employer's regular group medical plan. Is that what you're saying?
Absolutely. In Medicare, anyone that is on an employer plan, even retired and on an employer plan, an agent should be very cautious in what they're doing because in some cases it is best for the employee to stay on there if the employer permits it. Prescription drug is an area that I find that can be an issue because when you move over to Medicare, you are now leaving the umbrella of the employer plan if you're going into a Medicare Advantage or Medicare Supplement with Part D, and then you may be exposed to what they call the donut hole or higher costs. In group insurance, the cost of prescription drugs oftentimes gets buried in the group insurance, so it doesn't affect that aging employee. So as agents, and even if you don't work with us today, please, as you know, it's part of our certifications, you need to be careful and cautious when you're working with a person that is on a group plan, because oftentimes if they leave that, they can't go back. Right. So you want to always do what's right for the individual.
For the individual. And you're leading to a good point. You work with individuals, you work with businesses, you work with families.
Yes.
You work with people in Monroe County, Livingston County, throughout New York State.
I'm licensed in a couple dozen states. You can see that on the website. I list them. And oftentimes those states that are out there right now are as a result of my policyholders or members moving out of state to other areas, relocating. And because I build personal relationships with my clients, they let me know and they say, can you take us? Can you stay with us as we move? And so, yes, there are ways that can happen so that I can continue to be their agent in other states.
Wonderful. Mm-hmm. And if somebody wants to use your services, just to make sure people know this, do they have to pay anything?
No. That's very clear on our website, as you can see it right now. In fact, there's a little piggy bank on there, and I've had a couple of people, I've asked them if they've ever been out to the website, and they said, yeah, I remember the piggy bank, because it says, no, there is no cost for our services. We're not allowed to charge either by rule, but I am aware that there is someone in the area or two that do charge $50 a year to provide them with the services that they shouldn't be charging. But I'm not the patrol. I'm not going to go anywhere with that. But I'm just saying, no, we do not, and most agents and the agents should not be charging for their services.
It is one of those things that is good for people to know in case they've never worked directly with a broker or an agent, which is that brokers should not be brokers earn commission, but they earn commission directly from the health insurance companies, and the person who's being insured is not charged anything for a broker's services unless it's something highly unorthodox that I'm not aware of, and also that bottom line is that you're not paying any more money as a result of the broker being paid commission. The insurance industry is structured this way, so it doesn't matter whether you go to a broker or you go directly to the health insurance company, you should be paying the same amount of money.
In terms of the money,
same, yes.
But that brings about a point that I have often mentioned to people, because we can provide, or even your agent, if you have another agent that you have a good relationship with, that agent can provide you with a lot more service than just having a toll-free number. And another thing, be very careful. There are more and more scams going on for Medicare beneficiaries today because of our new Medicare ID cards that are scrambled numbers with letters and numbers in them, that people are receiving phone calls from strangers, and they claim that they're with this company. They know the products in your area, and what they want to do is enroll you into something that they say doesn't cost you anything, is going to provide you all these benefits. And how do you know that they're legitimate? How do you really know who they are or where they're coming from? If you give them your Medicare ID number, you could be feeding that into a system that's going to cause you a lot of problems down the road. Yep. Very important to be careful of that, and also the services that can be delivered by an agent versus just calling the company. Sure, a lot of companies do a really good job, especially our local companies. They do work hard for our local community. But when you have an agent, when you have a problem, my clients can call me. They can tell me what's happening. And in their worst time, in their time of need, I can do that three-way call with them and get the company on the other end, and we can figure things out, and I can speak for them on their behalf. And inevitably, they're so happy and pleased after it.
Always better for you to be the one making the call to the company. The consumer, should be reaching out to the company so you know who you're talking to. Before I let you go, let's just say one more time your website. This is Deborah Adams, Medicare Resource Solutions, your web address, and is there a phone number?
It's MedicareResourceSolutions.com. And the agency phone number is 585-484-9000. And if you're calling to speak with me, leave that message. If you're calling to speak with another person from that you see online at our website, leave that message. Or if you're in a specific area, leave that message so that we can direct your call where it needs to go.
Deborah Adams, Medicare Resource Solutions, thank you so much for joining me today on Business Voice.
Thank you. God bless.
That just about wraps it up for this edition of Business Voice, a program of the Greece Regional Chamber of Commerce, sponsored by Pet Saver Healthy Pet Superstore. I'm Sarah Lentini, delighted to be your host, and I hope that you tune in again right here on WYSL next month.
You've been listening to Business Voice. The Greece Regional Chamber of Commerce serves businesses, nonprofits, and individuals throughout the region, focusing on promoting economic and community development and serving as the voice for business. The Chamber offers networking, education, advocacy, community events, and business services. It serves as an important platform for business leaders and citizens to come together in support of common goals.